Scoliosis is a medical condition which is characterized by an abnormal curvature of the spine. The spine can be an S-shaped or a C-shaped curve. Scoliosis can occur at any age, but it usually occurs before puberty when the growth spurts happen. While the cause of scoliosis is unknown, also called as idiopathic scoliosis, there are many conditions which are associated with scoliosis, such as genetic, neuromuscular, or some spinal tumors may be associated with an abnormal curvature of the spine. Hi, I am Dr. Varun Agarwal, a robotic and endoscopic spine surgeon practicing in Bareilly, Uttar Pradesh. I have been trained in Germany and Switzerland, and I bring these advanced technologies and techniques and the latest information about spine disorders and techniques of spine surgery to you. Don't forget to like and subscribe and hit the bell button to get regular updates on our channel. Symptoms of scoliosis can include uneven shoulders, hip or waist, one shoulder blade appearing more prominent than the other and leaning to one side. In some cases, scoliosis may cause back pain also. Treatment options depend upon the severity of the curve. Mild curves can be just monitored and sometimes even braces can be applied. Moderate to severe curves may require surgery to correct the curve to prevent its progression and making it worse. Physical therapy and exercises may also help in mild to moderate cases. Early detection and intervention are essential for good and proper management of scoliosis. One of the worst aspects of scoliosis is that if it is left untreated, especially in moderate to severe cases, the curve may progress and hampers the patient's ability to effectively breathe. Scoliosis can vary in severity, and while in some individuals may experience only mild symptoms or cosmetic concerns, others may develop more significant spinal deformities that can lead to serious ill health complications. In severe cases, untreated scoliosis can lead to chronic back pain, respiratory problems, and decreased mobility. As the spinal curve progresses, it can exert pressure on the surrounding nerves, causing nerve compression and also pain. Additionally, severe scoliosis can also hamper lung function by reducing the space for the lungs to expand, leading to breathing difficulties and decreased exercise tolerance. Another challenging aspect of scoliosis is the uncertainty surrounding its progression and the effectiveness of the treatment options. While some individuals may experience stable or even improving spinal curvature over time, see their conditions worse despite treatment efforts. This uncertainty can create anxiety and fear about the future, particularly for those diagnosed at a young age. Furthermore, scoliosis treatment, especially surgery, can be physically and emotionally demanding. Surgical interventions, although often necessary for severe cases, carry a risk such as infection, bleeding, and neurological complications. Recovery from scoliosis surgery can be lengthy and may involve a period of restricted activity and rehabilitation. Overall, the worst aspect of scoliosis is its potential to impact multiple aspects of the person's life, including physical health, emotional well-being, and quality of life. However, early detection, appropriate treatment, and ongoing support can help individuals manage the challenge associated with scoliosis and improve their overall outcomes. Scoliosis, which is characterized by an abnormal curvature of the spine, affects millions of people worldwide, with varying degrees of severity. Traditional treatment methods for scoliosis often involve invasive surgeries which can pose risks and lengthy recovery times. However, advances in medical science and spinal surgeries have led to the development of minimally invasive techniques and robotics treatment options for scoliosis, offering patients a safer and more effective alternative. This video explores the principles, techniques, benefits, and future prospects of minimally invasive treatment of scoliosis. Patients need the latest and most credible information. I, Dr. Varun Agarwal, a robotic and endoscopic spine surgeon, bring to you the latest information on spine diseases and latest information on advances in the field of spine surgery. Don't forget to like and subscribe the channel and hit the bell button to have regular updates whenever we upload a video. Minimally invasive treatment for scoliosis aims to correct spinal curvature while minimizing tissue damage and reducing post-operative complications. Unlike traditional spine surgeries, which require large open incisions and extensive muscle dissection, minimally invasive techniques utilize small incisions and specialized instruments, allowing surgeons to access the spine with minimal disruption to the surrounding normal tissues. Key techniques in minimally invasive spine surgery. Percutaneous screw fixation. One of the primary techniques in minimally invasive scoliosis surgery is the use of percutaneous screw fixation. This procedure utilizes small incisions on the back to insert the screws to fix and stabilize the spine. With the help of robotics and image guidance, these screws can be applied to the spine with small incisions even less than 8 to 10 millimeter in a highly accurate and precise manner without damaging any of the normal surrounding structures or nerves which are present around the spine. Tubular retractors. Tubular retractors are narrow cylindrical tubes that act as a channel through which a doctor can operate upon the spine by using a microscope and visualizing the anatomy and details of the spine through that working tube portal. This helps to minimize the damage to the normal surrounding spinal muscles, which in a traditional spine surgery need to be cut and dissected to expose the spine. Tubular retractors facilitate the insertion of instruments and implants, enabling precise correction of spinal deformities. Endoscopic techniques. Endoscopic approaches utilize specialized cameras and instruments inserted through tiny incisions and visualize and treat spinal pathologies. Endoscopic procedures offer enhanced visualization of the surgical field and enable targeted interventions with minimal tissue disruption. Endoscopic techniques are particularly beneficial for patients with thoracic or lumbar scoliosis as they provide access to the spine through very small incisions. There are many benefits to minimally invasive spine surgery. Reduced blood loss. Minimally invasive techniques minimizes blood loss compared to traditional open surgeries, reducing the need for blood transfusions and associated complications. Faster recovery. Minimally invasive spine surgery typically results in shorter hospital stays and faster recovery times, allowing patients to return to their normal activities much sooner. Preservation of muscle function. By minimizing the muscle damage and trauma, minimally invasive surgery helps preserve the normal muscle function and reduce post-operative pain, facilitating faster rehabilitation and improving patient outcomes. Cosmetic benefits. The smaller incision used in minimally invasive surgery result in less scarring and improve cosmetic outcomes compared to traditional open procedures, enhancing patient satisfaction. Reduced risk of infection. Smaller incisions and decreased tissue trauma reduces the risk of surgical site infection, minimizing the need for antibiotic therapy and post-operative complications. Challenges and considerations. While minimally invasive treatment for scoliosis offers numerous advantages, certain challenges with minimally invasive spine surgery for scoliosis exist. These include surgical expertise. Minimally invasive scoliosis surgery requires specialized training and expertise to ensure optimal outcomes. Surgeons must be proficient in advanced techniques of minimally invasive and robotics with the nuances of minimally invasive instrumentation to give a better outcome. Instrumentation and its limitations. The use of minimally invasive instrumentation may pose challenges. In cases of severe or complex scoliosis deformities, surgeons must carefully evaluate patient anatomy and pathology to determine the suitability of minimally invasive approaches. Cost considerations. Minimally invasive procedures may be associated with higher upfront costs due to the specialized equipment and instrumentation which is required. However, reduced hospital stay, reduced ICU stay, reduced expense on medicines, and blood products, rehabilitation expenses are reduced, and all these offset the upfront cost of the minimally invasive spine surgery. Advances in technology and surgical techniques continue to drive innovation in minimally invasive spine surgery for treatment of scoliosis. Future development may include the refinement of robotic assisted procedures, the introduction of novel implant materials, and the integration of augmented reality and navigation system and artificial intelligence to enhance surgical precision and outcomes. Additionally, ongoing research aims to optimize patient selection and refine surgical protocol to further improve the safety and efficacy of minimally invasive scoliosis surgery. So to conclude, minimally invasive treatment option for scoliosis represent a significant advancement in spine surgery, offering patients a safer, more effective and less invasive alternative to traditional open procedures. By minimizing tissue trauma, reducing blood loss and expediting recovery, minimally invasive technique enhances patient outcomes and satisfaction. With ongoing technological innovation and surgical advancement, the future holds great promise for further improving the management of scoliosis through the minimally invasive approaches.